Hi, I'm Jennifer. Today we're going to be talking about root canal treatment. Root canal treatment is one of my personal favorite dental treatment to perform. Inside each tooth, there are fine root canals that contain the nerve and blood supply. When these tissues become infected or dies, you can develop severe toothache or an abscess. A root canal aims to remove the infection and save your natural tooth. At One Health Dental, we normally start with an initial consultation visit. At that appointment, we examine the x-ray, discuss your options, and decide together whether a root canal, an extraction, or referral to a specialist is best for you. You'll then return for the treatment if you choose to go ahead. Root canal treatment usually takes 2 to 3 appointments. At each visit, we place a small abscess opening in the tooth, so from the top here, clean and shape the canal, so we remove all of the nerves and the blood supply from the tooth. Clean and shape the canals with fine instruments, so we go in there, disinfect them with sterilizing solution, and then place a sealing filling inside the canals. If there is an active infection, we may also prescribe antibiotics. It's important to understand that even when everything is done carefully, root canal treatment still has a risk of failure over time. A small number of patients can have ongoing or recurrent infection or pain and may need retreatment, surgery, specialist care, or even extraction in the future. Like all procedures, there are possible complications, although they are uncommon. These include instruments breaking inside the canal, difficulty finding or negotiating very narrow canals, temporary pain or swelling if the disinfectant solution leaks beyond the root, material extending slightly beyond the root tip, or acute post-treatment pain. We usually manage with pain relief and sometimes antibiotics. In rare situations, these complications can mean extra visits, referral, or removal of the tooth. The final restoration is critical for long-term success. After the root canal, the tooth often needs a strong filling and in many cases, a crown to properly seal and protect it. Crowns are a separate additional cost, but they significantly reduce the risk of the tooth fracturing or becoming infected. So we place a crown sort of on top of the tooth like that. On this page, you'll find our full written consent form, which explains these points in more detail, including alternative options such as extraction or referral to an endodontist. We encourage you to read it carefully and ask us any questions. Our goal at One Health Dental is that you feel fully informed before you start. Understand the benefits and risks and leave your treatment with expectations met and your questions answered.